Here's my audience. Hello, my name is Ty Goff, and today I'll be presenting to you skin cancer. And during my presentation, I'll tell you a few things such as who's at risk, what causes it, and how to refrain from getting skin cancer. Skin cancer is the fastest growing cancer in the United States. More than 1 million people are diagnosed with skin cancer in the U.S. every year. 1 out of every 3 cancers diagnosed in the U.S. is skin cancer, so it's very popular. There are a few causes for skin cancer, but the sun is responsible for over 90% of all skin cancers. What is skin cancer exactly? Well, first off, it's also called neoplasms. It develops in the epidermis and is a growth on the skin that can be caused by a number of things. Who's at risk? Well, anyone can get skin cancer, but it's more common in certain people. Smoking tobacco, for example. Smoking tobacco doubles the risk of developing skin cancer. One's complexion. People with light-colored skin, hair, and eyes are more likely to get skin cancer than people with dark skin complexion. So the Caucasian race is more likely to develop skin cancer than races such as Hispanics, Asians, African Americans, because their skin complexion is dark, their hair is dark, and their eye color. Age is also a risk factor. People at the age of 40 or more are at a greater risk. Also, people who get a lot of sun exposure and get sunburn. Most cancers develop on areas of the skin that's exposed to sunlight, and sunlight is the main cause of skin cancer. Genetics is also a risk factor. People are more likely to develop skin cancer if one of their family members have had it before. Tanning booths. Tanning booths expose you to ultraviolet radiation, which causes skin cancer. Tanning booths are very popular and can keep your skin tan year-round no matter what type of climate you're living in. Tanning in a tanning bed is bad for your skin. It saps away your skin's youth and increases your risk of skin cancer, but tanning is still on the rise. A survey shows that 53% of Americans feel that they do not look better with a tan, and 63% say they are not attracted to someone if they are tan. But anyways, for your skin's health, stay away from tanning beds. There are different types of skin cancer. They're either classified as non-melanoma or melanoma. Non-melanoma is least dangerous, but it's the most common. It rarely spreads throughout your body. Melanoma, on the other hand, is rare and more dangerous because it is likely to spread throughout your body. The common appearance of melanoma is an asymmetrical area, an irregular border, and color variations, as you see in this picture. Although it's less common, it's responsible for 75% of skin cancer-related deaths. There are around 60,000 cases of melanoma each year, so it's still pretty regular. Although melanoma is the most dangerous, the most common skin cancer is basal cell carcinoma and squamous cell carcinoma. Basal cell carcinoma occurs in patients who are fair-skinned, older, and have a family history of skin cancer. It is rarely life-threatening, but if it's left untreated, it can cause disfiguring, bleeding, and produce local destruction, such as you see in these pictures. It usually looks like a raised, smooth bump on the sun, and it's usually on the sun-exposed skin of the head, neck, shoulders, and is often mistaken for a sore that does not heal. 20% of these cancers occur in areas that are not sun-exposed, such as the chest, the back, arms, legs, and the scalp. But the face remains the most common location for basal lesions. Basal cell carcinoma can usually be diagnosed with a simple biopsy. This usually involves scraping a small piece of skin and is checked for cancer. There are many ways to treat basal cell carcinoma, and most of them have a success rate of 90% or more. Although if it's left untreated, it can be very difficult to eliminate. People who work outdoors are at a greater risk than those who work indoors for developing basal cell carcinoma. For example, a construction worker or a lifeguard are at greater risk than an accountant at a bank because they spend all day in the sun. Squamous cell carcinoma is another cancer that is very common. It forms in the squamous cells, which are found in tissues. The tissues that surface the skin, the lining of hollow organs, and passages of the respiratory and digestive tracts. Therefore, squamous cell carcinoma can arise in any of these tissues. It is caused by long-term exposure to the sun, and it strikes more than 200,000 people in the U.S. every year. This type of cancer is characterized by red, scaly skin that becomes an open sore. When it's left untreated, it can develop into a large mass. Skin cancer has a few signs and symptoms, such as sores or changes in the skin that do not heal, ulcers in the skin, discoloration, or changes in existing moles. A scar-like area, as you see in the picture, is usually white, yellow, or waxy, and is also poorly defined borders. If this place is shiny and taut, it means that there are small roots, which makes the tumor larger than it appears up under the surface. So what you see is actually larger than that. Also, some other signs and symptoms of an open sore, which bleeds or oozes or crusts. That is a common sign of basal cell carcinoma. A shiny bump. It can also be tan, black, or brown, especially in the dark, just like you see in this picture. A reddish patch or irritated area, or a pink growth, as you see on this woman's face, are all signs of skin cancer. Skin cancer is treatable, but the treatment is dependent upon type of cancer, the location of the cancer, the age of the patient, and whether the cancer is primary or a reoccurrence. No matter what the cancer, surgical excision is the most common practice when treating skin cancer. They remove the area affected by skin cancer in about 1 to 2 meters of the skin surrounding the area that's affected. The main goal of the doctor is to remove or destroy the cancer with as little damage as possible. Certain actions can be taken to reduce the risk of skin cancer, such as avoid use of tobacco products. Using tobacco can double your risk. Reducing the exposure to UV radiation, so stay away from tanning beds and stuff like that. Avoid getting sunburned. Stay out of the sun when it's highest in the sky, which is usually from 10 to 3 during midday. If you are going to be out in the sun, wear clothes that protect you, such as long sleeves, a hat. If you're not going to wear this type of clothing, use at least 30 SPF sunblock, and reapply that sunblock as the manufacturer directed, or either as you feel needed. This is an example of a guy who took it to the extreme. But in closing, skin cancers are the fastest growing cancers and affect over 1 million Americans every year. They are becoming more common, with tanning in general becoming more popular. Skin cancers are dangerous, and if the right steps are not taken into consideration when exposing yourself to the sun, you could be at risk. And that's it. And this is my audience.